Hi, I'm Sharon Coleman. Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Usha Rajagopal, and we're talking about a couple of different topics today. Do remember that any advice we give you today, you're going to want to consult your own physician as well. So, Doctor, the next topic we're discussing is labiaplasty, and I'm not familiar with this, so tell me, what is this procedure?
So labiaplasty is a procedure that we change the appearance of a woman's labia minora or majora.
Okay.
And most of the time it is due to a combination of factors. It's either a functional issue for the patient, that means it pinches, tugs, chafes, or she's concerned with the appearance. For most women, it's a combination where it's part of both that causes them to have them come in to me for a consultation.
Okay. Who would be a good candidate? Is there an age range or anything like that?
It's interesting that it's not age related in the sense that the shape of a woman's labia is genetically determined, just like how tall or short she's going to be. So I have women come in their young 20s all the way up to 60s.
Oh my gosh.
And it really cuts the whole spectrum. So I have certainly young women who are students, moms who are middle-aged. Now I have women who are older, and professionally it can be all professions, all the way from moms, like I said, students. I've had lawyers, I've had pilots, I've had teachers. I mean, it's
really
everyone.
Quite the broad spectrum.
It is a broad spectrum.
So walk me through the process. Let's say I come into your office and I'm interested in having the procedure done, or I'm not quite sure maybe what can be done. That's probably the case sometimes with patients that come in.
Yeah. The reason people come to me is because they know I do a lot of labiaplasties. I've been doing them since 1999. I've done over 1,000 in this amount of period. They come to me because of two primary concerns. Either they are not happy with the appearance, or they're very self-conscious and they don't have the self-confidence. And equally or not more important is issues with functional issues. That means the size of the labia causes chafing with clothing. They can't wear tight jeans, they get irritated, and sometimes because of the amount of tissue, sometimes they're more prone to yeast infections. Or it could be hygiene issues. So these are the reasons they come in. And then when I see them in consultation, I do a thorough examination. First I talk to them, go over the medical history, see what their concerns are, and then we do an exam where I'm really quite open. They have a mirror, I'm talking to them, going over their anatomy, going over their concerns, and then we'll talk about whether they're a good patient or not.
Okay.
And then if they're a good patient, then we go to the next step. Then I talk about surgery, what we'll be doing in surgery, and what kind of surgery it is. With labiaplasty, it is the way I perform it, it's actually an office procedure. That means it's done in the office under light anesthesia. That means a woman, she's not asleep. She's awake, but she's relaxed. We give her something to relax her, like a Valium by mouth. But when I'm doing the surgery, absolutely no pain at all. So during the surgery, she can even be talking to me, or she may be dozing off from the Valium. That's about it. And then we do recommend that she have a friend or someone take her home. And time off is usually about a week.
What's the recovery time? How much downtime do you have, and what does that look like?
So generally, initially I have them 3 days minimum of complete laying in bed rest.
Okay.
And then after that, I say they could go back to work or light activity. So if you work in an office, that's fine. And then in about a week, they actually feel quite good and they can do a little more activity. But for full exercise, swimming, playing tennis, it's about a month.
Well, what are the concerns that they need to be focusing on during that time that they don't want to interfere with in terms of recovery?
Initially, after the surgery, the area does tend to swell up a lot. And it can tend to bleed because it's a highly vascular area. So usually when we recommend stay at bed, the 3 days I want them in bed. And then we usually give them antibiotics for around this time, want them to follow those instructions, take those antibiotics and keep the area clean.
Great. Now, what's the satisfaction rate?
I actually ended up doing a survey in 2007 and 8 for we collected patient survey for a whole year. The survey rate was over 90% satisfaction in the sense that 100% of the women who had it done would repeat the surgery, and 100% of the patients who had it done would recommend it to a friend of theirs.
That's fantastic. Thank you, doctor. It's great to hear about this. Now, if you'd like more information about Dr. Rajagopal, you can call 415-392-3333.